Welcome to Engadget Tomorrow. I'm Imran Sheikh, and this is where you get to hear about tomorrow today. Today we're talking about new AI medtech for cancer screening and AI-enabled brain implants. Let's start with the new AI cancer screenings that could cut radiologist workloads in half. A newly published study in the Lancet Oncology Journal has found that the use of AI in mammogram cancer screening can not only safely cut radiologist workloads nearly in half, but do it without the risk of increasing false positive results. Basically, the study found that the AI's recommendations were on par with those of two radiologists working together. The study was performed by a research team out of Lund University in Sweden and accordingly followed 80,033 Swedish women with an average age of 54 for just over a year in 2021 through 2022. Of the 39,996 patients that were randomly assigned AI-empowered breast cancer screenings, 28%, or 244 tests, returned screen-detected cancers. Of the other 40,024 patients that received conventional cancer screenings, just 25%, or 203 tests, returned screen-detected cancers. Of those extra 41 cancers detected by the AI side, 19 turned out to be invasive. Both the AI-empowered and conventional screenings ran a 1.5% false positive rate. Most impressively, radiologists on the AI side had to look at 36,886 fewer screen readings than their counterparts, a 44% reduction in their workload. However, the lead author, Dr. Christina Lang, warned in a release, these promising interim safety results should be used to inform new trials and program-based evaluations to address the pronounced radiologist shortage in many countries, but they are not enough on their own to confirm that AI is ready to be implemented in mammography screening. We still need to understand the implications on patients' outcomes, especially whether combining radiologists' expertise with AI can help detect interval cancers that are often missed by traditional screening, as well as the cost-effectiveness of the technology. Cancer detection has been an aspirational goal for computer vision researchers and AI companies for years now. I mean, who doesn't want to be the company to build the tricorder that infallibly spots cancerous growth in the earliest stages? Machine vision systems designed for these screenings have improved steadily in recent years and in specific cases have shown to be as reliable as human clinicians, with the likes of IBM, Google, MIT, and NVIDIA investing in similar cancer screening research in recent years. Now let's move on to an AI-powered brain implant that helps patients regain feeling and movement. Keith Thomas from New York was involved in a driving accident back in 2020 that injured his spine's C4 and C5 vertebrae, leading to a total loss of feeling and movement from the chest down. Recently, though, Thomas had been able to move his arm at will and feel his sister hold his hand, thanks to the AI brain implant technology developed by Northwell Health's Feinstein Institute of Bioelectronic Medicine. The research team first spent months mapping his brain with MRIs to pinpoint the exact parts of his brain responsible for arm movements and the sense of touch in his hands. Then, 4 months ago, surgeons performed a 15-hour procedure to implant microchips into his brain. Thomas was even awake for some parts so he could tell them what sensations he was feeling in his hand as they probed parts of the organ. While the microchips are inside his body, the team also installed external ports on top of his head. Those ports connect to a computer with the AI algorithms that the team developed to interpret his thoughts and turn them into action. The researchers call this approach thought-driven therapy because it all starts with the patient's intentions. If he thinks of wanting to move his hand, for instance, his brain implant sends signals to the computer, which then sends signals to the electrode patches on his spine and hand muscles in order to stimulate movement. Plus, they attached sensors to his fingertips and palms as well to stimulate sensation. Thanks to the system, he was able to move his arm at will and feel his sister holding his hand in the lab. While he needed to be attached to the computer for those milestones, the researchers say Thomas has shown signs of recovery even when the system is off. His arm strength has apparently more than doubled since the study began, and his forearm and wrist could now feel some new sensations. If all goes well, the team's thought-driven therapy could help him regain more of his sense of touch and mobility. Even though the approach has a ways to go, the team behind it is hopeful that it could change the lives of people living with paralysis. Chad Bouton, the technology's developer and the principal investigator of the clinical trial, said, "This is the first time the brain, body, and spinal cord have been linked together electronically in a paralyzed human to restore lasting movement and sensation. When the study participant thinks about moving his arm or hand, we supercharge his spinal cord and stimulate his brain and muscles to help rebuild connections, provide sensory feedback, and promote recovery. This type of thought-driven therapy is a game changer. Our goal is to use this technology one day to give people living with paralysis the ability to live fuller, more independent lives." Thanks for listening to the show. Make sure to rate, review, and subscribe on Apple Podcasts. Today's show featured journalism by Engadget contributors Andrew Tarantola and Mariella Moon and was produced by Spoken Layer. I'm Imran Sheikh, and we'll talk more tomorrow.
Spoken Layer.